this is my trip, of course, to Cameroon in West Africa, and this is a picture here of kind of where in Africa we went. So, you know, all the Ebola stuff is kind of over here. Actually, I can show you here. Oh, where's my little? This out here. So all the Ebola stuff is kind of in this area here. So it's about like 1,500 miles away from where we were at. Although Nigeria, which is the country that just was north of there, did have Ebola there as well. But they actually, you know, were Ebola free for more than 21 days by the time we had gone. So they just had a small outbreak there. So of course the other thing that was up here in the north of Cameroon, they had Boko Haram and kind of the girls that were captured. So it's kind of, but where we were at, we were actually down here. So kind of far away from that aspect of things too, in kind of northwest Cameroon there. Cameroon is a country that is mostly French speaking, and so when we landed there, we landed in Douala, which is the port city, and most of the people there speak French. They do have English kind of as their second language, and most of them prefer to speak French. Very hot and humid on the coast, but very different where we were at. We traveled about 8 hours by car to the hospital of Mingo there. One interesting thing was when we were at the in Douala, we had a stop off at the bakery to get some food for lunch, and the driver couldn't go in with me. Of course, the driver speaks French and English, and so I went into the bakery to buy our lunch, and of course, no one there wanted to speak English to me, so I had to point to things and then say, "Is that?" and kind of pointed to the line. I waited in line, and they were outside in the car waiting for me because we were taking another person to the airport on our way out. So it took me about half an hour, but I was really making good progress. But I was wondering what they were thinking about me being there, you know, not speaking any French and waiting. But so it's nice to kind of get to a place where there's mostly English speaking. 2 of the provinces in Cameroon speak English there, and so that's where we worked at the hospital. You know, so it was nice. But a lot of people, of course, who came to the hospital didn't necessarily speak English, so it was kind of helpful to have people that spoke French too. So. Of course, this is a sign in Mingo, so a little across the road from the hospital there. So the girls out with one of our many hikes, Hannah and Elizabeth there.
That's a road?
Well, we were standing on the other side of the road taking the picture. So, yeah, so this is the sign out in front of the hospital. Basically, this hospital started, I think, in 1952. It was started as a leprosy hospital. And so they got all this land from the hospital there, the Cameroon Baptist Convention did, because they were treating the lepers. And so they got all really nice piece of land there, really very temperate, very green and lush there. But the leprosy is not so much what they do anymore. They do have people who have had leprosy, and they actually have a ministry. They make different crafts and things, and they will sell those to kind of make money. So that's one of their ministries they have there. The hospital itself, there's a picture of that, and here there was when I kind of thinking about Ebola, the hospital there thought about that as well too. They actually would ask people if they had traveled from other countries, but they had a little sign that was like right here that talked about that. But that was pretty much the only thing I heard about Ebola the whole time I was there, was just that little sign there, and I asked about it if they had been prepared for it, and the people from Samaritan's Purse had sent them materials to use in case they did have an Ebola outbreak, but so far they haven't had that issue, so that's good.
Is this where you went last time?
This is where I went last time too, yep. So this is my 3rd time going to the hospital there, and my family's 2nd time, so yep. So
Okay.
we went for, I went for 2 weeks the first time, 3 weeks the second time, and this time was 4 weeks, so we extended by a week each time, I guess. So the Metzgers went with me last time, we went 2 years ago. So, but basically the hospital there has about 250 beds, and they're hoping to expand over the next coming years up to like 500. They have a surgery training program there that teaches, called the Pan-African College of Christian Surgeons, that trains a number of surgeons. They have the internal medicine residency program, which is mostly what I did teaching with, and they have 4 years that they go through that. They mostly focus on the adult side, being internal medicine, but they also do take care of the pediatric patients both on the ward and then somewhat reluctantly, I think, on the nursery area there. They don't feel as comfortable, I don't think, with that, but there's kind of no one else to do that at the moment, so they do kind of their senior residents kind of cover there. And they do have pediatricians like myself that kind of rotate through there, but they don't have any full-time pediatricians. They're hoping to get a nurse practitioner possibly who has a pediatric interest, and also a full-time pediatrician hopefully in the coming year or so. So they're working toward that. The area that's kind of behind the hospital, really kind of nice and lush looking, kind of green. We went during kind of the beginning of the dry season. So last time we were there was the rainy season, so it rained every day. So it didn't rain the entire time we were there, except when we were in Douala on the coast when it was really humid. So it rained the one night that we landed there, but pretty much was dry the whole time. It was a little bit dusty, and they have the harmatome, if I say that right, is kind of basically the dry season. They kind of get all this dust in the air, and they have a bunch of grasshoppers and so forth. Although I really didn't see any grasshoppers while I was there. They claim that there's a bunch of them. I think maybe we missed that, but this is a picture of
80 degrees?
Well, probably 70 to 80 degrees, yeah, but not humid at all. So very nice, very pleasant weather, yeah. This is our materials we brought with us. We brought our couch from home. No, not really. They put pretty much everything, you know, they really load cars up there, and lots of cows, you know, so there's lots of cattle there that we would see kind of crossing the road on our trip to get to the hospital. On the way to the hospital, we bought some fruits there. They have, of course, really good pineapple, and, you know, getting it right from where the source is really nice. And we bought some pineapples from them, and our driver got his shopping done too. It's much cheaper to buy it on the way to the hospital. At the hospital, they don't grow it as well, so it's more expensive. So we got some of that and enjoyed that our time there. We stayed in a really nice house. You know, it was really, and that part was not a difficult thing. This house was built by, when I went 2 years ago, there were a couple missionary couples there that were doctors, one internal medicine doctor, pediatrician couple, and two pediatricians a couple that were both pediatricians. And they actually raised support. They went with Samaritan's Purse, the organization I went with, as a 2-year post-residency program. So basically Samaritan's Purse kind of helped them with getting over there for 2 years right after residency to be able to kind of see what mission life is like. And basically after they finished, they built this house with some of the extra money they had so people could come back and work there. And one of the couples actually is planning on coming back yearly to kind of work in the area there. So it was neat to see that. I have to say their work was really nice to see too. And they put together a couple of books that were very helpful for me. You know, it's always hard doing Western medicine in another country, but they kind of had, you know, these are the medication options, these are kind of the things you do. And for things that we don't see all the time, you know, not doing as much inpatient stuff, it's helpful. They really did a good summary. And it's helpful for the nurses there too. You know, they kind of have protocols that they help follow for when they don't have a pediatrician. So I think it's been really a blessing to them. We had our horses right outside there. You know, it makes me think of the Fulani people there, a Muslim people group. They're very, you know, they're not one of the militant Muslim people groups. They're very relaxed and, you know, very friendly. We saw them many times over there. They come to the hospital a lot, and but they ride horses. And so, you know, one of the things that we do is they saw a lot of horses around because they really took care of them. But these horses were actually just right outside our window. So the girls enjoyed that. Sometimes they weren't always on the other side. Sometimes they're on the other side of the fence. So the girls would get out there and brush them and so forth. They weren't supposed to be out, but they did get out sometimes. This is kind of more the dust there that you see, and, you know, just kind of from the dry air and so forth there from the harmatome there. So we went hiking a lot. You know, this is me with Sierra on my back there, and very steep to kind of get up there. But, you know, once we got hiking, it was very fun. You know, again, we met a lot of people along the way. One of the nice things is that, you know, everyone says hi to you, and you kind of say hi to them back. They ask you kind of how you're doing, and so it was very nice to see that.
No, 3430, Bonnie, please call
We met
3430.
a couple kids along the way. One of our trips on the blog, the girls did a good job of kind of keeping track of the blog. I think this is sort of a picture from the blog, but we were out hiking one day. There's several waterfalls. They don't have as much water again as they had in the rainy season when we were there. But these three kids were out hiking, and we kind of came across them. We kind of asked them which way to the waterfall, and he said, well, there's one that's 45 minutes this way, and then they said, but there's one right over here. So it's like, okay, it's not that far. So we followed them, and we ended up going across a couple of horse pastures and like a cow pasture there, and like probably about, you know, half a mile or more maybe that we just followed them over this rough terrain. There's no trail. We just kind of hopped over fences. I was wondering where we were going. We actually did end up at the waterfall, and so we got to see that. And we had brought some snacks to kind of snack on. I was with the three of the girls there. Jana was back at the house with the Absira, but we had some cookies that we had with us. So I shared those with them, and so we had a good time with them, and so it was good. It was fun. You know, it was a little bit precarious though, where the waterfall was not very easy to see. It was kind of we were kind of over a ledge to kind of look down at it. So I didn't let the girls get very close, but it was kind of neat to see though. So we got to the waterfall. There's the girls. They really enjoyed their time there. They got to, again, I think this is on the blog too. They made a couple of friends there, both from some missionary people that were visiting, and as well as some of the missionaries there. But they got to ride horses. The one guy, you can't really see him very well. His name is Mamodu. He's one of the guys that helps. He is Fulani, one of the Muslim people group there. And again, he helps with particularly take care of the horses for the doctors who have horses there, and takes people on rides. One interesting thing kind of on the mission aspect of things is he's kind of learning about the gospel, and kind of the missionaries there are having an opportunity to share the gospel with him. And they had a version of the Nativity movie, but it was in French, because most people there, of course, speak French. However, Mamadou, being from the English-speaking province, doesn't speak French. So one of the surgeons was translating what was happening for him, because he speaks the Fulani language. And so it was interesting kind of the ways that, sometimes even local people there would need translation. So I had to put this picture in. Janet told me I shouldn't put it in, but this is us playing bingo at Mbingo. So Friday nights we would have fun and enjoy playing bingo there, and so we did that. You can see in the background our little Christmas tree here. So Janet cut that out. So and the girls made the ornaments while we were there. So kind of interesting being away from, I guess we didn't miss snow here, but we didn't have snow there either. But just kind of a little remembrance of Christmas. The girls did some things like making snowflakes for the hospital, and so that was pretty fun. We had they of course play soccer a lot there. You can see kind of the one soccer ball here is a little bit messed up. They kind of taped it together. But they enjoyed playing soccer with them and having fun with the kids. Of course, kids weren't the only people playing soccer. The cows also play soccer there too, because it's such a good sport. So they had fun. And so we talk about the cows. They don't have a lot of chickens there, so chicken's very expensive. But and beef is not inexpensive, but it's less expensive of a meat. But we have some of the foods there. Of course, they have lots of different fruits there that we got to eat and try there. Like the tree tomatoes is the one down here, and these are actually oranges. They're a little bit more yellow than we might see them here. But they had a number of good fruits there that we could buy even there. This is one of the things that they eat called gedwa, which is I'm sorry. Actually, I'm thinking, what is it called? That's actually, I think, from Papua New Guinea. They have. Mixing up my countries now here. But it's kind of like a green there, and they eat that. I actually thought it was pretty good, but they eat that with, it's called jama jama. So fufu and jama jama there. So the fufu is this cornmeal-based kind of like I guess, grits, I guess might be a close way to put it there, is what it kind of has the texture of. And then they also had the beef here that they had there as well. So we also got to go to church while we were there, and the church is they had quite a number of services while we were there. They had a service on kind of every Sunday, but they also had them on Christmas Eve and Christmas morning as well. So we went to that. It's a very gospel-centered church as far as they preach, kind of pretty typical for a Baptist preacher, I guess I would say. But they also have a lot more of kind of more of a Pentecostal style of worship. So they really have a lot of dancing and clapping, and even one time they had an offering that they went up and danced and clapped, and of course, everyone kind of does it, so I went up and did that too. But so the other interesting thing, of course, they translate everything into French as well. They have a short version of the sermon in French after they finish, so it's quite a long service. So it kind of took a little while to get through, but it was good, and we enjoyed going to church. The girls also got to go to children's church. They're standing here with one of the the kids we met last time there, and he actually is a kid his dad works at the hospital in the surgery part of the hospital. He had a congenital heart condition that he had a surgery at one of the other. There's a Catholic hospital that helps do surgeries for adults and kids, and so he actually had surgery there and has done kind of a miracle in himself there of what they were able to do for him. We were going to church one day, and everyone was walking the other way. And it was the 60th anniversary of the church, and so they actually went to the front gate, and everyone dressed up in all their different uniforms. They have girls, they have what they call a 3-H club, kind of like 4-H here, I guess. And then they had the ladies group and then the men's group and the teenagers as well. They're all dressed in their uniforms, and they marched and sang up to the church there. That was the day they had the offering where they had everyone kind of come up and dance up front to give the offering. But 60 years for the Cameroon Baptist Convention there in the country. And I guess that's one point too. The hospital is really run by the Cameroon Baptist Convention. They do have the missionaries who are there, and they certainly help out a lot. But they really kind of run things as far as and the missionaries are really trying to let them kind of take the lead on things now. So I think that's really good in that way. Speaking of the missionaries, you guys might recognize Dr. Barton here. So those of you guys who've met him and his wife here, she's over there, Debbie. And this is us practicing. One of the neat things about being there over Christmas, for the whole month of December, they had, first of all, they have chapel every morning, so you get there about 6:40-ish. Sometimes it's little, you kind of fill into the front and kind of go back. Some people, of course, don't always get on time, but they have they had 2 singing groups each morning, and they would be from different places. So the missionaries did a singing group, like the people in the maternity ward did a singing group, people from the ENT clinic. So they had 2 groups every morning that sang from traditional songs to kind of more songs with the rhythm and those kind of things. They certainly like to clap and dance. Our group didn't clap and dance as much, but Dr. Barton did a good job. And we did have a Cameroonian, which I don't think you can see him in the picture, but he did the drum because we did Little Drummer Boy was one of the 2 songs that we sang there. I tried not to sing too loudly, so it wouldn't make it too bad of a show there. And then there's Dr. Palmer too, Dennis Palmer. He's kind of been there. He was the one who started the internal medicine residency program, and then Dr. Barton kind of came alongside him. And then his wife here too, she's Nancy Palmer. She does a lot with logistical stuff there, and they both do a lot of work. And then, of course, our girls sing up there too. So that was neat to be a part of. And then one of the things that they did as well, on Christmas Eve, they have a tradition of going around and singing to all the different wards. So they would sing to, I think this is on the, maybe the surgery ward, I believe is where that's at. So we ran around and sang a couple of songs to each of the wards. And particularly on the kids ward, we actually had a day where we actually did a party. We brought some, bless you. We had a party that we brought, or some stuff that we brought for a party there the day before, so we had some candy canes and stuff like that to the kids. The next day we did this sing to the ward there, and one of the surgeons who's there with another post-residency surgeon who wants a pediatric surgeon. He's going to do that after he finished about 1.5 years of this program. He's going to come back to the States, but he basically had that hat, so I got to wear my hat there and sing. Elizabeth is wiggling her loose tooth, but the rest of us are singing. There's another, this is an ear, nose, and throat doctor who's there. He's there for a 2-year post-residency program, and they have 4 younger kids there, so we enjoy fun time with them. They also have a speech pathologist she's there for about 1.5 years. So that was neat. Some of our preemie babies that are having difficulty with feeding, which she actually didn't have a lot of experience with that, but she was very eager to help out with that and was really got some help from another one of her colleagues who is actually in Kenya, kind of asking some help of how we can help these preemie babies with their feeding issues. So that was good. And then this is just one of the patients that I saw on the surgery ward as a consult, but we actually were there just after that to sing. So this is one of the patients that I saw there on the children's ward. Kind of has a sad story in a way. You know, he has a bone cancer, and that bone cancer is not something that can be fixed. He actually has metastasis to his lungs. And they actually had to amputate his leg so that he wouldn't have pain there because it was causing him so much pain, and that's why he came in. So we made that diagnosis, but one of the things I think was we're able to share with him the love of Christ, but also too I gave him so a couple of pictures and some crayons, and the day that we hand out things there, and he showed me this the next morning, just the beautiful pictures that he had colored for us there. So so I remember pray for him. If you think about it, but he is, in a difficult situation. They do have a really good program there, though, as far as hospice, where they go out to the village and help with, kind of the needs that they have. So, but I think, there's definitely a lot of challenges in this environment, too, what we can offer to patients. One of the places I worked was in the nursery, and this is kind of their NICU. They have kind of 2 little beds where they have incubators there, and this is one of the moms, and this baby was probably about 30 weeks is kind of what we estimated there, and one of the babies this one did well with feeding, but still had to, one of those things that was helpful again to have that booklet that the other pediatricians had made up about how many calories per day they need and kind of how to adjust that in a way, which the nurses kind of were doing on their own without a pediatrician there, but definitely helped me to kind of remind me and things that we don't do here all the time.
Is his knee swollen?
No, his knee is okay. It's just the way I took the picture. So, yeah. No, his knee is okay. He actually, other than that, really was doing fine. So, another baby that we had there in the nursery was having a little more difficulty breathing, and we did some CPAP, and they used their kind of like a bottle that has some water in it, and they put a little tube in there, and that kind of puts the pressure, so that actually helps them to breathe better. And so the baby was on some CPAP for a while. That one was probably about 28 weeks or so, and that baby was doing okay when I left. That was the one that was not feeding as well, and that's where the speech therapists have kind of been helpful there too. And then we saw some of the normal babies in the nursery and as well. One of my big things that I spent time, this is the children's ward, and this is a couple of the residents that I worked with there. Actually, I should say she's a resident. Her name is Dr. Virginie. She actually was from the French-speaking. She's kind of what we call francophone, and so she spoke French. And then we had Edith. Edith was a nurse practitioner, and she actually spoke English. So we kind of had both sides of it as far as helping us. But although Dr. Virginie spoke English very well too, but for our French-speaking patients, she was very helpful to help us translate. Although Edith spoke French too, because they're all required to take that. But Edith, they only do 1 year as a nurse practitioner, and this was Dr. Virginie's first year as well. So we kind of had a lot of learning, but they were very bright, and just I learned a lot from them as well too. Some of our patients, we saw a lot of different things, a lot of nutritional issues. We saw some things that were difficult to figure out, like this child's kind of swollen lips. He'd been consulting other places, and we didn't really figure it out. But one of the ear, nose, and throat doctor was going to do a biopsy and try to see if we can figure out, from a pathology level, what was going on. This is a little tiny baby that started out like at 1.7 kilos, and I met the baby at 3 weeks. It was only 1.5 kilos, so we weren't going the right way. And it turned out mom's milk supply was not in, and we actually were able to get the baby above birth weight before I left. Was still in the hospital, but was gaining weight, and it seemed to be just a milk supply issue from what we can tell. But just the skinniest child I've ever seen. This is a gentleman and his son who came into I did some outpatient consulting too for people, and this gentleman spoke French and he spoke English, but he didn't really want to speak to me in English, and the person who was there to translate was a person who speaks, there's a Pidgin Creole that they speak as well too, and he spoke that as well, but he didn't really want, he wanted somebody to speak French. So Dr. Virginie, the French doctor I showed you earlier, she came in and translated, and he was really pleased with that. And then at the end, he asked me if he could take my picture, and he pulled out his iPad and took my picture. So I said, can I take yours and your son's picture too? So I took their pictures. And he came back the issue that he had, and we came back about 3 weeks later, and he was doing better, but I was happy to follow up and see him again. So he came back the day before Christmas, actually. So
When he came back, would he speak to you in English?
He spoke to me in English anyway, but he wanted to explain the problem to her. And the other thing is, too, is that he had records, which often has to bring records that are in French. So it was helpful to have Dr. Virginie to translate for me. This is them again in front of the pediatric ward with myself there. And then a couple of the nursing staff. One of the things that I went with I didn't take a picture. I should have taken a picture, but the Southwestern Foundation kind of helped me out with my dad. Had passed away in September, and sent a pulse oximeter with me to go. And they were just thrilled to get that and all the little probes that we were able to bring there too. So I think it's really going to be a great thing they'll be able to use. And so kind of their Christmas present, they're really excited about that. But this is the head nurse and then one of the other nurses who worked there. They really did an excellent job of caring for patients. And then kind of finally the end here, and I'll go through it again in a minute, but I don't know if any of you guys recognize this picture. You guys know who this is? This is one of the doctors who is fighting Ebola, and he is on the cover of Time magazine. Of course, we have the American doctor, and then we have this doctor here. And then we also have this doctor who died of Ebola as well. So the interesting connection is both of these doctors trained at this hospital. So they worked, at Mingo Hospital in the PAC surgery program. And one of them gave his life and taking care of patients, and the other one is risking his life to take care of patients. So it's just interesting. The doctors, the residents that I worked with there, they knew these two doctors and they knew them well, and just kind of what they were able to do and help out there with. So, and then finally, of course, can't end without seeing Dr. Barden. So I just want to say, definitely pray for him. He's doing good work there. He seems to be overloaded with what he does. He really spends a lot of time at the microscope, and it's very helpful. Most hospitals don't have a way to know what the patients have as far as what kind of tumor it is, and they do have treatments for some of these tumors, even the difficult ones, but without knowing what it is, it's hard to treat. And so, and even infectious stuff, he looks at different slides, and it's amazing what he does with the help even of some pathologists here that he sends pictures to. But he was going over there originally to train the doctors in the internal medicine program, which he does do the training and teaching and stuff, but he really focuses a lot of his time on pathology because it is so helpful. And he's getting referrals now from other hospitals in the area, so he's doing a good job. And I think he and his wife Debbie definitely say hi to everyone, and definitely remember to pray for them as they're and they're in the States at the moment, visiting with one of their new grandchildren. But it definitely is good to keep them in mind and pray for them too. So.